Hello and welcome to the Perley Health CEO Town Hall. I'm Jay Innes, Director of Communications, and I want to thank you for joining us. Today's Town Hall is designed to keep you informed with the latest updates and news from our Perley Health community. In this session, Perley Health CEO Hoffer will be sharing key insights during his second online town hall, which is open to the public. Before we get started, I'd like to mention that we experienced some technical difficulties during the recording, so that what you'll see is an abbreviated version. We appreciate your understanding. Now let's join Akash Hoffer as he discusses the Perley Health Kudos, our thank you cards, already in progress.
You've probably seen these cards in the past. Anyone can write a kudos card. You just pick one up and let her rip. And if you write one of these, it's an opportunity to show your gratitude and your support to another member of the Perley Health community. You also give a chance, with your consent, to our communications team to amplify your inspirational messages. And some people here are doing very difficult jobs, and it's important to let them know the impact of the work that they're doing and the care that they're providing. So a kudos card is a great way to do that. And what I thought I would do is just read a short excerpt from a kudos card that Heather Moxley, one of our Uber volunteers, wrote. She's also the chair of our Family and Friends Council. So she wrote the following to say thank you to Lori Stuckless and the support services team. So Heather helps new residents move in and to relocate. So she helped move in a new resident. And when she arrived at the labeling room with 3 bags of clothes, the team was concerned because they were already working flat out. But very quickly, they joined together as a team and made a plan to make sure things were running smoothly and were all smiles. And she wanted them to know that they were a great team. And coming from someone like Heather, I think that means a lot. So thank you, Heather, for doing that. I also want to take this opportunity to draw your attention to our employee engagement survey. For staff who are on this call, this is a survey that we run on an annual basis. So the nice feature of that is we get to compare employee engagement from year to year. Engagement is behind everything. I feel it in myself, to be honest. When I come to work and I'm fully immersed and engaged, I feel like I make better decisions. The decisions are better informed. I'm also less grumpy if I didn't get enough sleep. So it helps that way. So we are trying to maximize employee engagement. And in order to do that, we need to know what's standing in the way, what obstacles there are, and what we can do to remove them. So, for example, over the years, we've heard loud and clear that our staff sometimes struggle to maintain work-life balance. I personally try to set a good example on that front, but we know that it's not easy. So later, I'm going to talk about our intergenerational childcare program, which is designed to help our staff with young children juggle their various responsibilities. And the employee engagement survey was one of the inputs that helped us realize that we need to do more to help staff to put people first. So the employee engagement survey is open for the next 3 weeks, and it only takes a few minutes to complete. I know we run a lot of surveys, but it is a really important and empirical way to get information. We talk to people in the halls and so on, but when we get numbers and data, it really helps us to improve. So it's very, very key. Tom, if we can go to the next slide, please. So speaking of kudos, I'd like to say a very special thank you to this team, to the foundation team, and to our donors, some of whom I know are on this call. And I want you to know that you are making a huge difference. Because of the fundraising that happens here, we are able to provide really exceptional care. We're able to get into areas like research and innovation. We're able to teach. We're able to do knowledge translation. And more, the foundation is helping us to grow. So bottom line is the foundation is a big part of why we are such a special place. And none of this would be possible without this powerhouse team. I want to say as well, I'm not a fundraiser. And anyone who has tried to fundraise knows how hugely challenging it can be, especially in today's environment. And yet, somehow, the foundation has inspired giving to an unprecedented level. Some of you may know that the foundation recently wrapped up a $10 million capital campaign. So that's something that was absolutely inconceivable a few years ago. And again, I just want to say thank you for your commitment, your engagement, and for your giving. For those of you who give, no matter what amount you give, it makes a huge, huge difference here. So on to some, I guess, more good news. If we go to the next slide. We're moving. I feel like we were frozen in place for a while as we responded to COVID. And then even after that, the system was just stuck for a long time, and it was really hard to move things forward and get some good initiatives going. The first one mentioned on this slide is primary care. So I just wanted to take a minute to explain why that's important. Any resident in long-term care at Perley Health or anywhere has access to a strong primary care team. You have access to a physician, you have nurse practitioner access, you have registered nurses, and so on. Unfortunately, that is often not the case for those living in the community. And here on the Perley Health campus, we have people living in the community in our independent living apartments. And some of our tenants would have moved from another part of town where they had access to a family doctor. Perhaps their family doctor has retired and nobody took it over. Unfortunately, that happens a lot. And that makes it really hard for people, especially as they age, if they have several medications that need to be monitored and so on. If you don't have good access to a family doctor or to primary care, sometimes your only choice is to go to hospital when you're not feeling well. And that is not good for anyone. It's not good for the patient. It's not good for the hospital when it can be avoided. So we want to help our tenants stay independent. And the key part of that is by providing primary care. So we're very, very pleased that we were able to open a primary health care clinic here in July. This is a goal that we have doggedly pursued for years. We took, to borrow a sports analogy, many shots on goal. We tried this going back 14, 15 years ago. And for whatever reason, it was just never possible. What we've done is started small. So our very first goal was to provide access to primary care to our tenants. So that is in place now. We have a partnership with an organization called Dream Team Medics Clinic. So this clinic provides primary care, dermatology, palliative care, geriatric psychiatry referrals, and also on-site blood collection. So for those tenants that still have access to their primary care provider that they had before they moved in, that's terrific. For those that don't, so if you're a tenant or if you know a tenant who needs access to primary care, please contact the Dream Team and access their services. We're very pleased that we've been able to put that in place. The second piece of good news I want to share is around our Center of Excellence, which you've probably heard the term, but maybe it's still new to you and you're not 100% sure what we mean by that. The idea behind our Center of Excellence is to drive exceptional care and to share actionable, practical knowledge across the health system. At the end of the day, if you look at what Perley Health actually is, we are a registered charity. And so part of being a charity is believing in the greater good and supporting other people and other organizations. We can't just be, an island in the healthcare system and in the long-term care system. We need to share our expertise with other organizations. So one way to do that is through research. And the team at the Center of Excellence, led by Danny Sinden, is doing more and more research. So more and more research that is being published. And this is really important because going back to data and numbers, when you have research, you can point to evidence that says, if we do something this way, it's going to improve quality of life compared to that way. So one issue with research, though, is that doing the research is not enough. Reading the research is not enough. It's putting it into action that's the real difference maker. That's when quality really starts to change, but it's hard to do. So we are working on that. Our Center of Excellence is driving that. And one way we're doing that, for example, is around wound care. So we know that skin and wound care is a huge issue. Pressure injuries and so on have a huge negative impact on quality of life of residents. Any of you that know someone that has dealt with that will have seen how bad that can be. So one very simple way to communicate with people and other organizations is to develop tip sheets. So the Center of Excellence developed a tip sheet on skin and wound care, which does three things. So first, it demonstrates the impact that the Registered Nurses Association of Ontario best practice guidelines have. It demonstrates the impact that those guidelines have had here at Perley Health. So for example, we've seen a greater than 50% decrease in the average of worsening pressure injuries. We've also seen a greater than 50% decrease in the average of infection rate. So as you can imagine, this now has a huge positive impact on quality of life. The tip sheet also provides a checklist, if you open it up, that other long-term care homes can follow to improve skin and wound care. And it points you to resources to do that. So it's a step-by-step guide on how to improve skin and wound care. But again, often reading is not enough to do that. So the third thing the tip sheet does is it invites long-term care homes to contact our Center of Excellence for hands-on support. So this is new, uncharted, and very exciting territory for our organization. It's something that if you go back to 2010, so almost 15 years ago, we published a document called Creating a Seniors Village. It was a 15-year strategy. And right in there, this goal was written to develop a Center of Excellence that does things like this. So I want to talk for a minute about sharing knowledge and how we do that. So one way we do that is by sharing our knowledge of how to reduce falls. That's another huge problem in long-term care. And our fundamental job in long-term care and here at Perley Health is to keep people safe. That's job one. But at the same time, without compromising quality of life. There are ways to keep people safe that destroy quality of life. So we don't want to do that. So again, we are looking to the evidence. What works? How can we reduce falls? What have other clinicians and long-term care homes done to reduce falls and improve quality of life? So the Registered Nurses Association of Ontario, again, has best practice guidelines that are evidence-based, they're research-based. And so we've implemented those. And part of our strategy, as some of you know, is comfort care rounding, which has made a huge difference. So we've seen a 50%, it seems like anything we attack, we reduce by 50%. So same outcome with falls. So where we've introduced comfort care rounding, we've seen a decline of up to 50% on some of our units. We have also used simulation-based training because unfortunately falls will always happen. And then the question is, how do you respond? And it's much easier and much calmer to do that with simulation-based training, where there's a calm and controlled environment where staff can think about how to respond when a fall does occur. So very exciting for us is we've been able to share this knowledge with other long-term care homes because we have the evidence, we have the outcomes and the impact. So Osgood Care and nearby Osgood are implementing our comfort care rounding approach. And they're just thrilled to be able to do that. So our plan is to do more and more of that. And one of the ways that we're doing that is through the skills days, which are mentioned on the slide as well. So we have these skills days where other clinicians can come to us. We're holding one on supporting a good death in long-term care, and we have so much expertise in this area. I hear all the time, and I get beautiful letters from family members just expressing their gratitude in the midst of their grief about how supportive our team was when their loved one passed away. So again, as a charity, we feel an obligation to share our expertise with other organizations, and skills days are our way to do that. So that's something that is ramping up and is going to be available for clinicians, other long-term care homes to come and join us. So what I'd like to do now is move on to a couple of updates, if we can move to the next slide, starting with intergenerational program and childcare. So this is something, again, many of our initiatives unfortunately take a long, long time to get up and running. We come up with an idea and then we have to work with officials to make it happen. We have to get approvals. We have to sometimes raise money and so on. So when it comes to intergenerational childcare and program, for those of you that have not heard about this program here at Perley, I just want to take a minute to explain what this is about. We know that there's a massive shortage of high quality childcare in the system. It's kind of like long-term care. The waiting lists are very long. Parents have to think far in advance to make sure that their child can secure a spot before they can go back to work. And at the same time, we are always looking for ways to support our staff better. And as I mentioned before, work-life balance is one of those things. So I remember when my first child went into daycare, I was driving across town to drop him off and then rush back in rush hour traffic to get to work. So that was not a great arrangement. And instead, one of the things we realized we could do is why not construct a childcare center right here on the campus at Perley Health. And then we said, well, while we're at it, why don't we design the space to accommodate people in wheelchairs, for example, to accommodate seniors so that we can have intergenerational programming, so we can have the young and the old come together, just like they would in olden times, in villages and so on. There would just be a lot more intermingling. So we want to make that happen here. We're already seeing that. Some of you may know we have a play group that's happening. And the thing is, though, we are not a childcare provider. Andrew Fleck Children's Services is. They're also a nonprofit that has locations across the city. And they have the ability to provide $10 a day daycare once this new daycare center here is constructed and open. So the idea behind it is to give Perley Health staff priority access. And we've made significant progress on this project. I'm not here to make an announcement yet because we're not quite there, but the design is nearing completion. And I want to thank all of you who took the time to participate in our focus groups over the years. And programming is already underway, as I mentioned. The other puzzle piece that is falling into place is the foundation has expressed a strong interest in fundraising for this project. Not just an interest, but an ability to fundraise. There seems to be really strong community interest in this kind of program. So everything is falling into place. One of the last items we need to nail down is it took a long, long time to get the funding formula from the province of Ontario that lays out how much money is available to operate and to construct the facility. So this doesn't involve renovation and construction for us. So I hope to be able to make an announcement soon. But in the meantime, for family planning purposes, if, and it's still an if, but if we were to start construction in early 2025, so in the next 3, 4, 5 months, if we start in early 2025, then we would be able to open the daycare hopefully in early 2026. Those are rough guidelines. We need approval of the project first. We still have some work to do. But I did want to share that news that we are making progress, and I invite you to stay tuned. The other project that I wanted to touch on is the idea of expansion. And as some of you may know, part of our strategy includes a growth target. So we've never had that before, and our growth target is to double the number of seniors that we serve by 2035. And I want to talk for a minute about why that's so important. The basic reason is that our waiting lists are overflowing. But the real reason is that those waiting lists, if we don't grow, those waiting lists will just get longer and longer and longer because there are more and more people who require the kind of care and the kind of community that we provide at Perley Health. So the reason behind that is if you think of people like my mother-in-law, who was born in 1946. She is independent, she's in good health, but soon she'll be in her 80s and hopefully in her 90s. And through that process, there is a significant portion of the population who does require either independent living or long-term care. And that group is going to double because the baby boom generation was so huge. So the number of people who are going to be joining our waiting list is just going to grow and grow. And we need to grow to keep pace with that. So again, our target is to grow, is to double the number of seniors that we serve. And there's many ways to do that. You can expand some of the services that we provide. But one obvious way is to build more long-term care and to build more independent living. So this is a goal, again, that we've been pursuing for many, many years. It has not been easy, especially when those of you who have borrowed money over the years and may have a mortgage, you know that interest rates, I was going to say doubled, they actually multiplied. And we would be borrowing money to do a project like this. So when your borrowing cost multiplies, it can destroy your business case. So that's essentially what happened. Construction costs, just to put icing on the cake, also multiplied. They've stabilized a bit. And now things are calming down. So we're working very, very closely with the province, with the Ministry of Long-Term Care and other partners to make expansion on our campus a reality. Again, we're a ways off from any official announcement on that. But I did want to let you know that it's a goal for us. It's something that we want to pursue. We're going to put a lot of energy into. And my commitment to you is to keep you informed like this, even when I don't have much I can say. But also, and I think this is really important, to provide opportunities for you to input into the design. I know just in my own neighborhood where I live, the best construction projects are the ones where the builder invites in the community and they know they're going to get an earful about X, Y, or Z. It could be parking, it could be sight lines, it could be whatever, but they also get a lot of benefit because they get input. And so for a project like this, we've benefited in the past because our stakeholders, our neighbors, know that they might have to access this service. So they want to give us input to say, here's how it could look, here's how it should work, here's what's worked, here's what hasn't. So that's my commitment to you, is we will create opportunities for input once we get around to designing the facility. So if we can move to the next slide, I want to talk about people first, and specifically our Perley Health champions. So this is a new program. I want to spend a minute explaining it. The reason behind it is we believe strongly in recognizing people's individual contributions, and also, on the other side, illustrating the impact that those individuals make. So we're going to run a video in a second to show what this looks like. But the other reason is I frankly do not crave the limelight as the CEO of Perley Health, and I need members of the team to help me communicate how great this place is. And this is super important. Someone recently said, Perley Health has no right being the best kept secret in Ottawa. And it's super important because to do successful fundraising, to do successful recruitment, to have the right team members, we need better awareness of this organization. People know the name, but they don't know the value that we bring. They don't know the care that we provide. They know our reputation often, but they don't understand us like they do other institutions like the Ottawa Hospital, like the Children's Hospital, like Queensway Carleton, and so on. So the other issue that we have is the public still has a very, very negative perception of long-term care. And what it means is people resist applying for long-term care. They hold off, they delay, and often it's very risky to do that because the story they've been told is once they get here, it's a nightmare. Well, we know it isn't. So we want to share what life is like here. We want to share the pride of our staff who provide care. And so here on the slide, we have Ricky. Some of you know Ricky, and I think I've talked enough for this slide. Let's see what Ricky has to say.
Perley was selling these chocolates for nurses, and a family member gave it to me, and she said, I'm giving this to you because you are such a good nurse. You take such good care of my husband. I'm so happy you're here, so I got these for you. And honestly, that really impacted me because at first I did not feel like I belonged here or I was a nurse. So it felt good to be told that I'm doing good. My name is Richard Marion. I go by Ricky, and I am an RPN, and I work on the behavior unit in Gatineau 2 North. I've actually been working in mental health for the last 10 years of my life. I started at a place called Iris House in Windsor, and it was an assisted living facility for people with schizophrenia. I started off there as a security guard, and my boss said, Rick, you're really good with these residents. Can I train you to be a PSW? So I said, absolutely. So from there, my career took off, and for the last 10 years, I've been working in mental health. Perley Health is actually my first job as a nurse. I graduated recently in December, and I'm actually from a place called Windsor, Ontario. So when I was doing my consolidation placements, they told me about Perley Health. They really sold all the things about Perley Health as well. Like they told us we have a lot of resources for new nurses or nurses in general. So if I'm missing on skills, we have a lot of opportunities for skills for me to catch up on. So I like the fact that I'm working with another nurse. So right now I'm working with a nurse who's been on the floor for 20 years. So as a new nurse coming in, I felt a lot more comfortable working in this environment. And I'll tell you what, it has been a blessing working with that person. Ottawa has been nothing but beautiful. The communities have been amazing. And I honestly would love to live here for the rest of my life. I will say my whole team has honestly impacted my life. They made me really comfortable as a nurse. They make me comfortable as a person. Perley has been nothing but amazing and kind to me, so I want to thank the Perley community as well.
These are videos that are on our website or will be on our website. And so again, I want to share and thank Ricky for participating in that. It's not always easy to do, to be in the spot like that. But I would like to invite staff, volunteers, residents to share your personal stories with the Perley Champions project. And if someone's had a significant impact on you or your loved one, this is a great way to say thank you. It's a great way to help us with our communications. And if you're curious, without any commitment, you are welcome to speak with Jay Innes, our Director of Communications, who can tell you more about what this could look like. So there are some really, really engaging videos like the one that you just saw a part of coming up that I encourage you to watch and to share broadly. That's the great thing about this format is it's so easy to share through social media, through text or whatever, just to share with other people and raise awareness of the great care that we provide here. And if we move to the next slide, I just want to say thank you again to all of you for participating today. I hope you found this helpful. We're going to post a video of this town hall to our website soon, as Jay said. And with that, I will pass it back to Jay Innes to help with any questions that you may have.
Thank you, Akash, and apologies to everyone on the playback for the video. We will correct that. We'll get it into the recording of the webinar as well. And I also want to let everyone know that we're targeting December 5th as the release for the Champions, the Perley People campaign, and look for more information on our website as well as communications from our team on that. On that note, I also welcome emails at info@perleyhealth.ca in regard to anything you've seen today or heard from Akash. We're always welcoming of your comments and questions, and we commit to get back to you.